Anybody for public comment? Okay,
Phil, you got anything you want to say?
get his ear. Doesn't have his ear.
Turn your hearing aid up.
All right. Entertain a motion for approval of the minutes from September 9th. Any discussion? All in favor?
Aye.
Aye. Appointments. If we go down to appointments, it's the same that we've had all along, and I'll read them just for a second here. We have appointments. We have a vacancy for a contractor alternate. That term expires in 1/20/21. One for a well driller alternate, 1/20/20, and then a licensed sewage system installer alternate, 1/20/22. And these are all vacant, and we have no applications. Any applications or nominations from the floor? Okay. If not, we'll proceed to Lifeway's monthly report.
Good afternoon, Shannon Clevenger from Lifeways. I'm just going to go over a couple highlights from the packets that you received from Mary Beth. Regarding our strategic plan updates for better health, we have a post-hospital review team that's now in place to reduce hospital recidivism rates, which we're very excited about, to help people stop going back onto the psych unit. We also have completed our first recidivism training in August, with ongoing monthly training being planned. Under our header of better care, due to a demand for mental health services in the Jackson County Jail, we have added a clinician in the jail in Jackson. So now we have 2 master's prepared clinicians providing services in the jail. Better experience. Our HR department is evaluating resources for employees to address secondary trauma and compassion fatigue, and we'll be making recommendations to our leadership team to help support our staff. And we have brought on 2 interns and have established objectives for their learning experience while they're at Lifeways. Under lower costs, our workflows are being developed between our finance department and our contracts department to complete 100% claims verification. And we have monthly residential meetings that are occurring to monitor the costs and factors impacting our provider service line related to licensed residential care. Under the state innovation model, or the SIM funding, we are participating in community discussions around the pursuit of potential funding strategies to continue the work of SIM here in Jackson. The services that we provide under the SIM funding are crisis R&R and our social determinants of health screening and navigation services through 211. Under the Michigan Diversion Council Summit, Chad Sirk, who is our Director of Strategic Relations, and Mary Beth presented at this year's Michigan Diversion Council Summit. They were invited to be on the panel as we were identified as having promising practices relative to the work being done with the communities related to jails and law enforcement. And those are the highlights I have for you today.
Any questions, Commissioner? One question. The other provider that you hired, okay, does that mean that the jail's going to have 24-hour coverage?
The other staff person
Yes.
that we hired, no, it's during work hours.
Okay.
We provide services, we have crisis services, but our clinicians are there during business hours.
Okay, thank you. Okay, if there's no other questions, thank you very much.
Okay, thank you.
Region 2A semi-annual report.
Good afternoon. It's a beautiful day out there today, I have to say. You should have the copy of the report in front of you. It shows funding for Jackson County through 8/31 of 19. September funding isn't completed yet. Our providers have until the middle, like September or October 10th to get those in, so it should be coming in soon. But anyway, you'll see on the report the amount of funding that was awarded out in Jackson County for this year to date through August 31st. So the one thing that we added to the report this year was our number of hub referrals. That's through the State Innovation Model Project, where the Jackson Hub, and we've included that we've done 26 screenings and then we've had 76 referrals, and 66 of those were served by a Region 2 Area Agency on Aging, and the others were referred out into the county. From Jackson County residents so far this year through 8/31, we've received 9,597 calls, and many of those are referred to the Jackson County Department on Aging or other community partners for help with assistance that's needed. We also, in addition to the Jackson Department on Aging, we also award funding out to the Catholic Charities, which serves Hillsdale, Jackson, Lenawee counties, and Legal Services of South Central Michigan, which serves Jackson, Hillsdale, and Lenawee counties. Highlights about the report are, I just mentioned it's through 8/31. The MAP funding, which is Medicare Medicaid Assistance Program, is operates on a different year, so that's why some of those numbers may look a little strange. And pretty much the funding we received between fiscal year 18 and fiscal year 19 is pretty consistent. And we're also expecting it to be pretty consistent for fiscal year 20. Agency updates. I've talked about our Safe Haven program here in the past. That's a program we developed where we work with Adult Protective Services to help victims of elder abuse, and we do case management and help them find temporary housing while they work through their issue to get out of the abusive situation. We did receive 2 grants this year to fund that program, and we receive those again next year, and those are the Victims of Crime Act funding and the Prevent funding from Aging and Adult Services. We also were lucky to receive a Safe Haven Award for that project from the National Association of Area Agencies on Aging, and we did a presentation at their national conference in July. We received another award for our Assistive Technology program, where we look at technology solutions to help folks stay in their home, and those are sometimes as small as like a fork that has padding on it to help with eating for somebody with Parkinson's, or it can be bigger items such as operating a wheelchair. We also have worked with students at Spring Arbor that have a disability to make sure they can attend their classes and things. I mentioned the Medicare Medicaid Assistance Program. That's the program where we do counseling for folks that are either new to Medicare or for open enrollment for the Part D season. And the Part D season is when folks can review their prescription drug plan. And the period from October 15th through December 7th is when folks can review their medications to make sure the prescription plan is appropriate for the drugs that they're taking. We do counseling at our offices in Brooklyn, but also the Jackson Department on Aging does counseling. So if you know anybody in that situation, now's the time to get an appointment to have the Part D plan reviewed. In the past, we've saved, folks we've worked with in the 3 counties, over $1.5 million, because each year the plan formularies change on what drugs are being covered, and so it's always important to review those. We're busy working on our year-end reports. We're a little nervous there with the budget coming up and being approved both at the state level and at the federal level. The federal level, there's a continuing resolution that provides funding through November 16th, I think is the date. So it hasn't been finalized, but the funding, when they do that, is consistent with what it was in this year, fiscal year 19. And then the state funding, we're still reviewing the veto line items, but we don't think they affected any of our direct funding from the state at this time. Our multi-year plan, this was a year when we had to have our multi-year plan approved by the state commissioners, and they did approve that. And so now we're busy getting the plan in place and working through that. One change that came through on the state budget that was released last week, and we're looking for clarification on it, was the state respite funds that we were awarded were reduced by $25,000. We're asking and seeking clarification on that to see if we're expected to get that funding back, or if that's going to be the funding for this fiscal year 20. And I mentioned the funding for Jackson Department on Aging is similar to the recent years for fiscal year 20. We are, waiting final awards, and these continuing resolutions and such do affect the funding we can award out, but as soon as we have the final numbers, we will get that to Jackson County Department on Aging and the other contractors we have in the other counties. And then for our area plan, just a reminder that we do had focus group meetings and such to figure out the way to allocate the funds in the 3 counties, and those were well received. One newer thing that we added to our plan is options counseling, which better allows us to serve individuals in the 3 counties. That's something that is really being pushed by the Aging and Adult Services and MDHHS is the options counseling, and they want to make sure everybody can do that in a conflict-free manner. And so we are busily working on that. That's about all I have today if you have questions.
Any questions, commissioners? Thank you very much.
Yeah, thank you.
Next up is Michigan Works, and there's nothing there in a computer, and there's no one here to talk, so we will just go to the Department of Aging. Marcy?
Good afternoon.
Afternoon, Marcy.
As Julie Weatherby just mentioned, at the Department on Aging, we did receive notice of grant awards for the fiscal year that started October 1st. It is less than what we applied for, about $25,000, so we're making budget adjustments as needed. And the Friends of Jackson Seniors is a nonprofit that supports older adult services in Jackson County, and the Department on Aging staff work closely with them. And the Department on Aging worked with them to submit a proposal to the Dawn Foods Foundation for enough money to replace a meal delivery van. So that application was submitted a couple weeks ago, and we should hear in a couple months whether or not they may fund all or part of that request. And then what I wanted to do also today is a presentation with some census information and a little information about what services we provided this past year and a year ago. Let's see if I can, that's not gonna, all right. And Department on Aging services are part of the strategic plan with regard to healthy community, both with physical health and behavioral health. And the last census was 2010, and at that time it was an even 32,000 people who said they were age 60 and older who lived in Jackson County, and that was 20% of the entire population. So the increase compared to 10 years previous was just over 20% increase in the age 60 population for the county. And then there is a 2017 Census American Community Survey report about age 60 and older. So the number went up to 36,000, which is about 4,000 more than the 2010 census. So my point being, as we know, the baby boomer generation is turning age 60. And then this slide shows where they're living in where older adults are living in Jackson County. So the highest number is Summit. That's the green bar to the right. The city is second with the orange bar on the left. Blackman's pretty close with the blue bar. And then Leone is the brownish red bar. Those are the top 4 areas. So it is center to the county geographically. And then what I wanted to show you was, well, where do the people live who we are serving through the Department on Aging? And our primary 2 categories of services are social supports and recreation. It's about 20% of what we do, and then home services. So looking first at home services, which include these services listed right here. then this chart shows the number of home service hours, and the way our database works, it also includes nutrition site congregate meals. So, for example, Park Forest is in Blackman Township, so those meals are counted in Blackman Township. The King Center, Crouch Center in the city, so those nutrition site meals are counted accordingly in the city. So this shows you where the number of hours or meals provided. For us, the average age this past 11 months, this is an 11-month time period. We don't have all of September data entered yet. So for the most recent 11 months, the average age is 75.5 years. Average income is $1,831 a month, which is around 155% of the poverty level. And then social supports, that includes nutrition sites, exercise classes, educational classes, and then Julie just described the Medicare Medicaid assistance program. So these numbers include those services. So again, this shows you where the hours and meals were provided based on the township. And 108, we have an unknown address. I'm sorry, you have a question?
Okay. Steve?
Marcy, when do we do an analysis of the possible shifting of a meal, a congregant center to closer to the population of need? How do we do that, or do we not do that, or do we just try to make sure we have one in each township type deal, or 3 in the bigger townships, or how do we do that?
It's based on availability of an affordable location. That's the basis of it. And it's becoming more and more difficult to find one that's affordable. We've kept most sites where they've been traditionally, but we have relocated in the past. Because attendance, for example, in Brooklyn was very low, 12, 15 years ago, so we moved it to Napoleon. So we're open to moving sites, so it just means it will be closing a site to then relocate it someplace else. We're not in a position, unless we reduce other services, to add additional nutrition sites. Does that answer the question? Any other question related to that?
I had a question
Yep.
in regard. Thank you. In regard to what other entities, if any, in our county are doing what you do, doing what Department of Aging? Do we have any duplication of effort out there and so forth?
We haven't had duplication of effort for the services Department on Aging provides in the past. Region 2 Area Agency on Aging just mentioned they want to do options counseling. That's very similar to what the Jackson County Department on Aging does. We call it case coordination and support. And in the future, I see us moving into a more in-depth, what they call options counseling. So it's more of someone would have a smaller caseload and work with someone as their loved one is, especially helping caregivers navigate through the different services and resources that are available in the community. So that would be a potential duplication, is Region 2 Area Agency on Aging doing the options counseling. But all the others, no one else does Meals on Wheels. Our services are on a donation basis. They're suggested donations. We don't have set fees. There are cost share guidelines for respite. That's where a worker stays with a loved one so the caregiver can leave for a while, but we don't charge a fee.
If I may follow up, just options counseling, it just makes me think, right, I assume you two are going to coordinate so we don't have duplication, because it's the same dollar chasing the same people.
Well, our dollars have been cut, so.
Because we don't want to see, duplication,
Right.
More staff, more everything.
Right.
And the other thing I was thinking about when you were talking about spreading or providing services around the county, congregate meals, is the library probably, I don't know they're spread out around the county. Maybe they have a resource room that can be used for a few hours a day. I don't really know, but
Yeah, to relocate.
worth having a conversation about. Thank you.
And we do work well with Region 2 Area Agency on Aging. We have conversations all the time. It is a joint effort to meet the needs of older adults in Jackson County. So that'll continue, I'm confident. So. So then what this slide shows are the previous 3 slides, just where the population is, where home service and congregate meal counts are, and then the social supports and recreation participants. So they're similar in height and quantity. And then comparing the same 11-month time period for a year ago, and this time period we're looking at the grant time period, so it's October 1st. And it just shows a comparison between the number of Meals on Wheels a year ago to year-to-date currently, the number of home service hours, that's lighthouse cleaning, bathing assistance, respite services, dementia respite. And then our social supports and recreation participants a year ago, and then compared to year-to-date now, and then the congregate meal program. Other information with that 2017 American Community Survey, of the people complete of the survey, 31 said that they're disabled, meaning needing assistance with activities such as housework, preparing meals, some needing help to get inside their home, bathing and dressing. 15% have income below the $1,517 a month. That's below 150% poverty level. And as I mentioned earlier, our average for participants is 155% of poverty. And we are to target, for our in-home services, target low to moderate income, lower income, not Meals on Wheels, that's open to everybody, nutrition sites, senior centers. It's more the lighthouse cleaning, that's the one that we have to prioritize because we do have a lot of requests for that. And we don't have the resources to meet all those needs. So that's the one where we're targeting 150% of poverty or less. Not our other services so much. And then there's a Wayne State study called Invisible Poverty. So there's the national poverty levels, but in Michigan they also looked at having an income that's at a threshold that you can meet basic necessities of living. And they found that almost 38% of Jackson County age 65 and older have less than adequate financial security. And older adults, meaning age 75 and older, are more likely to have inadequate incomes than younger seniors because their income's been frozen for a lot longer, but costs increase. Women living alone tend to be more economically insecure, and Black older adults have more difficulty making ends meet than white seniors. And then the Center for Disease Control for Michigan, I just thought this was kind of interesting. Some statistics, here it shows on the right 65 years or older who report having a disability. That's not much higher than people 50 to 54 on the left. So people 50 to 60, their rates are high, well, between 30 and 35%. But those age groups compared to age 65 and older, they're not that much lower, the younger groups. And those reporting having fallen with an injury in the last year, here's a graph about that. And 55 to 59-year-olds apparently have more injuries. Maybe they're skiing down the ski slopes and break a leg. I don't know the background, but it's just, to me, interesting. It's not just age 65 and older. And then this is the age group that's coming up, that will be coming up and being age 60 and older in the next 10 years. Any questions?
Any questions from Mercy?
If I may.
Right.
And I don't mean to, I'm just curious if, Region 2, Department of Aging, I'm just curious as to the overlap. What is, it sounds like something new you guys are doing that we already do. What's the thinking with the board? What's going on with that program? Why the need?
The options counseling?
Yes.
Options counseling is something that it's a focus of Aging Adult Services Agency where we get some of our funding through. And Marcy and I meet monthly, and we'll set up some meetings to make sure we're not trying to serve the same folks. We're continuing to increase the number of calls we get to the agency, so we have to have some of our staff. We're not planning to add more staff, but the staff we have do some additional training on options counseling so that they can be more helpful to folks that call. But it's something we'll work out together.
Okay, so just, okay, as long as you guys are working together, because clearly, in these days, we don't have extra dollars for
No, we
duplication
don't.
of effort.
We don't.
And we don't want people to be confused, who, you know, where to call, too.
Right.
Right. Well, exactly. I'll leave it to you guys to work out, as long as we're not spending money twice for the same thing.
Exactly.
Yeah.
So.
Any other questions for these two ladies?
Thank you.
Okay, if not, we'll move on. Health Department monthly report.
Good afternoon. Just one thing on our personal and preventative health services, and then I'll move on to some of our other divisions. Initially, with our tuberculosis program, I wanted to give you an update that we've got 3 active cases and 1 inpatient case. From this case, we've been working on this summer, as I had talked to you about earlier. These were 2 individuals that were hospitalized at Henry Ford Allegiance Health. 7 of those contact people that we connected with are latent, meaning that they're not presenting with symptoms. 2 have completed treatment, and 1 we have secured housing for. And we have identified about 110 contacts through those 2 initial cases we had over the summer. Related to the other case that we've got, we have 2 individuals that are presenting as latent, and 100 contacts that we've identified. 65 of those have undergone testing at this time. And then just something else that I didn't put in the report that we've learned as of Saturday is that we do have 1 other TB case that's positive with an individual that's now hospitalized at Henry Ford Allegiance Health. So go ahead. Yep.
Rashmi, under communicable disease, where are we at on Hep A and C?
As far as our rates, or are you asking?
A year ago at this time, we were very concerned about Hep A, and it was spreading through, coming both from the east and the west.
Correct.
Have we got that under control, or is it still going to be a communicable issue going into the winter?
No, we didn't have an outbreak per se of the Hep A here in Jackson. So, great. And then, let's see if I can find my report. Sorry. Okay, moving on to our health education and our health promotion area. Mainly here I wanted to report on giving you an update of where we're at in researching some possible options for the car seat program. We have been in touch with Henry Ford Allegiance Health. They do not have somebody who's certified, but we're still continuing to have discussions with them and hope that we'll be successful in getting somebody there who could potentially get certified. We also don't know how long-term how long-term the solution would be. So we'll continue to have discussions with the hospital on that effort. Some other ideas that we found out that other counties are doing is that partnering with the Coles Cares Foundation, they work with community hospitals to do work such as this. Bronson Hospital out in the southwest area, Kalamazoo area, has used this foundation money to actually purchase car seats and to provide community care car seat check events with certified technicians. Sorry. And finally, the other piece that we've been referring our clients to since our program has closed down is the Buckle Up program through Mott's Children's Hospital. So we've been able to refer some clients to there, and we'll continue to work with some of the community area hospitals to find out what other models that they may potentially have. We've had discussions. Oh, Commissioner Shaw. Oh, okay. Okay. Oh, sure, go ahead.
Good afternoon, almost afternoon, Rashmi. Oh, it is afternoon. I'm just curious if you could know how many referrals you guys have had to make so far.
I can check on that number and let you know. We were working on the program through the end of the month, so, it's probably not, that many up to this point, but I can definitely find that out from staff and let you know. The other piece the other piece is we've also been in contact with Center for Family Health. We provided them with 3 years worth of data of the program that we had done. Unfortunately, they are not in a position to take on the program right now. So we weren't able to be successful there. However, we also talked to the Michigan State Police, and there's one individual there that we were given his name and number as a contact for potential clients. Unfortunately, he also is moving on to a new position within the state police, so they're not in a position to carry an inventory of car seats and carry that program on. So we'll still continue to research the option, and in particular try to work with Henry Ford Allegiance as much as we can to see if that could be a viable or possible solution there.
Question. When you say you're talking to Henry Ford Allegiance, okay, have you talked to their HAP program? Because their HAP program is trying to compete with 4 other programs for bodies here, or lives in central Michigan. And the HAP is over here and the hospital is over here.
Sure.
The hospital says no, the HAP program may want to say yes, and then advertise it on the car seats, HAP, and so on and so forth, like they're advertising on the billboards.
So you're talking about working with the health plan, primarily with that. We haven't reached out to the health plan specifically. We've been working with their trauma unit mainly to see if that's something that they could help. But we can explore that option potentially and see.
HAP plan, which is selling their product to the people, okay? And,
sure.
It might be interested in that.
Yep, we can.
Advertising them, pushing their product.
Right, yeah, we can explore that option as well, potentially. All right. Sure.
Rashmi, we have certified car seat fitters, correct?
Correct.
Have they agreed to volunteer at the hospital at all?
No, we haven't specifically approached them with it. We've got one person that worked at the health department, and then another that was like a backup that worked in our hearing and vision program. But we can potentially, if this works out with the hospital, we can see if that might be something.
Because I've become aware through the neonatal clinic that Medicaid will provide car seats for the some at need children, and that over 2,000 kids have been processed on average over the last 5 years at the hospital, and we're taking care of about 8% of that population.
Correct.
Number one. Number two, if it's a preemie, the hospital has to go through everything, and they're allowed to bill Medicaid then for car seats.
Right, yep.
So we're aware that there's that alternative also, correct?
That is correct, yep.
So an in-need child could receive a car seat through Medicaid if they began the process soon enough in the process. That way when they exited the hospital, they would have one.
Yep, and it doesn't have to be just during that neonatal period. I mean, we've reached a number of clients too that are on Medicaid that have taken advantage of the program as well.
So are we billing Medicaid on behalf of these people?
We have, yeah, we did before.
We're getting reimbursement.
Correct.
Okay.
Yep. But the other piece is, we're finding that a large number of our clients they weren't necessarily newborns or preemies that were coming in. They were, as they progress in age, they need those convertible car seats. So a lot of them are really needing help and assistance with, getting that infant car seat switched out and, what needs to occur after that moment and that kind of thing. So
it's my understanding through pediatricians and involvement, Medicaid pays for those car seats also.
For the convertible ones? Yeah, I'm not certain if they do for the convertible ones. I know we've gotten those through the Office of Highway and Safety Patrol, but I can check into that and see if that's, a potential
Typically, it takes
source.
a diagnosis and follow the process. Usually it can be an onerous process, but that's not on us. That's on the parents.
Correct. Yes, it is.
Thank you.
Just one thing quick to share on our emergency preparedness program. We are offering this seminar called a Whole Community Inclusion Planning Seminar that's geared toward vulnerable populations, and we offer it to a lot of our agencies that serve vulnerable populations and help assist them in how to do planning for emergencies and preparing yourselves and your families for that. So that's taking place on October 29th from 8:30 a.m. Sorry, that's typo in my report. 8:30 a.m. to 11:30 a.m. At the health department, and our Emergency Preparedness Coordinator, Stephanie Baker, will be providing that. 3 items to just update you on in terms of environmental health. One is our Sayers Road condemnation that we had on a methamphetamine contamination. The settlement agreement has been sent to the estate lawyer for signing, and the owner is aware that the home must pass a third-party clearance sampling in order to actually lift the condemnation order. So that's where we're at on that one. The second one was the Lake Columbia harmful algae bloom. The health department was notified on September 10th concerning a potential harmful algae bloom that is currently being investigated by the State of Michigan Water Resources Division and the Lake Columbia Homeowners Association. So we've been taking initial sampling on September 10th and 11th indicated that the presence of microcystine can cause health effects in humans and animals within the blue-green algae bloom that's forming there. These toxins can be of concern for public and pet exposures. The Department of Environmental Quality and Energy, or Great Lakes and Energy, excuse me, has collected and tested numerous lakes over the past 2 to 3 years, and they typically see these toxins only where cyanobacteria is present. So this informs us that the general messaging is for people and pets to generally avoid those areas where the cyanobacteria is blooming, so where this harmful algae bloom is present. But they can also be unaffected areas of the water body if the bloom is not widespread. So all reports at this time indicate that the bloom has rapidly dissipated within days of identifying this.
How can the public know which lakes or areas of water are infected by this cyanobacteria?
So at this point, there is no harmful effect because it's been dissipated. But typically, there would be a notice of a public health advisory put saying no contact with the water advisory, at this time, and we would put up a notice as the health department.
But do you test like all the lakes, or?
We test within those areas, actually DEQ does within those areas that potentially could have the algae bloom. So, and then the third item, finally, is a Lomar machine and tool. There was a first sampling that I had mentioned in a previous report that tested at 11 parts per trillion for a certain chemical, and that's just above the 10 parts per trillion of that screening level. So just as of note, an update on that is that a second sampling was done and occurred in August to confirm the test. And it came back at 18 parts per trillion, meaning that, there are levels that have been increasing in that area. However, we continue to monitor that enviromapping and other references for potential historical contamination sites and have been in consultation with the PFAS team at the state. And finally, it's noted that the 18 parts per million is quite low. The recommended contaminant level for this particular contaminant is currently under public comment and slated to be submitted to the governor at 420 parts per billion. And so this would not exceed what that rate would be.
But if you see a curve where it's going up and up and up and up, isn't that concerning?
Yeah, we would continue to monitor that, and if there is a trend going up, then yeah, we would definitely consider, continue to monitor that situation.
Thank you. Any other questions, commissioners? Go ahead.
Quick question. For the emergency preparedness seminar, is there a flyer for that by chance?
I do. I think I have one copy here, actually.
And is there... Or never mind, I see it here, RSVP. Okay, thank you. Do you have this electronic by chance as well?
I do, yep. I can send that to you.
Perfect.
As well. Yep.
Thank you.
Darius?
Nothing further.
Thank you.
Thank you, Daniel. Rashmi, just a quick question. I'm just curious. I can't really remember when it normally happens, but if when you get a second, can you send out an update of STD numbers to date when you get a moment for us? Pretty please. Thank you.
Is that for any particular one, or are you just looking for all of, in our, whatever we test for in all of our STD clinics?
Yes, please.
Sure, I can do that.
Any other questions, commissioners? If not, thank you very much for a good report.
Thank you.
Claims, entertaining a motion to approve the claims. Any discussion? All in favor? Aye. Other minutes, we don't have anything. November reporting schedule, and we're down to public comment, the second part. Any public comments from the floor? Committee member comments? Okay. Motion to adjourn. All in favor?